Let's talk a little bit more about the pros and cons of the different types of bariatric surgery.
So as we mentioned, there are three different major operations that we performing for the treatment of obesity. There's sleeve gastrectomy, there's gastric bypass, and there's lap band surgery. And the sleeve gastrectomy and gastric bypass both give you more reliable, faster weight loss in the first year. They'll also give you some chance of getting long-term weight loss. Gastric bypass is ideal for diabetics, people who are very serious diabetics because of the change in the hormones in your gut. However, they both require stapling or resecting or reconnecting your internal organs. And so that's a little bit frightening to people, but that's why they're so effective. The lap band surgery doesn't require any resection. It's just a 45-minute operation, outpatient surgery, so the recovery time and the surgical risk is less.
Is there a perfect procedure?
Absolutely not.
They all work, but they can all fail. And I think there's no magic bullet with this. What the surgery does is it gives you a tool to help you control your hunger and feel full, eat less and not be hungry, but it's not everything. The patient still has to buy into the old school stuff. Don't eat so much junk. Don't eat so much high-calorie carbs. Try and eat a balanced diet.
Well, which patient is going to choose what procedure?
Well, I think it really boils down to some of the stuff we've talked about. What risk will the patient accept? A lot of people they just will not have their organs cut. To them, it's too big a risk. A lot of people just say, oh my God, I'm not going to come back once a month and have someone stick me with a needle.
Well, is there a misconception in the general public that the lap band doesn't work anymore?
There is a misconception because many surgical programs have stopped performing the aftercare. And I've known many surgeons who have performed lap band surgery on patients and say, well, I'll see you in 3 months. I'll see you in 6 months. And it's very routine to see patients irregularly. And we know, and we've published on this, is that if a patient comes in at least 7 times in the first year, they will get more weight loss after lap band surgery than if they come less than 7 times in a year.
Have you seen an uptake? We know that there was a decline in performing lap band procedures. Or have you seen any uptake recently of patients getting lap bands?
It's definitely kicking back up. And I think that's a response to what we've been talking about, that there is weight regain after a sleeve. There are nutritional issues with a bypass. And it's still the old chestnut. You're not cutting anything. And so it's just there, and we're definitely seeing it on the up. And the notion that it doesn't work is ridiculous. I'm sitting here, I've had a band for 18 years. And, I'm doing okay. I was on 12 medicines, now I'm on 3.
Do you have a message for anyone considering that procedure or any bariatric procedure?
I think the hardest thing is to, number one, look in the mirror and say, I just can't do this anymore. Number 2 is to say, I'm just going to go and see somebody. And number 3 is to look in the mirror and say, this is not the easy way out. I am taking a positive step for my health and my life.
Thank you for joining us.
Thank you.